Okay, hi. Sorry I'm a minute or two late. We went a little long on the hike and brunch today, and I had a little trouble. We've renamed my public Facebook page, and I had actually a little trouble locating it, but it is January 28th, Sunday afternoon, 3 p.m. here in California. It was cold this morning at the beginning of our Sunday hike at 9, but it warmed up throughout the day. We had 13 hikers today, which was great, and did a lot of personal work along the way, and it was really magical as usual. I hope to be able to find a way to bring some of that magic to you live on these Facebook broadcasts and also on my weekly Feeling Good podcasts. We then, eight of the 13 hikers elected to go out to brunch. We went to the Joy Luck Palace in Cupertino Plaza here in South Bay of the San Francisco Bay Area. And we just had a fantastic experience, just all kinds of fabulous dim sum, and we had fun and laughed and played games at lunch and got to know each other. I feel so grateful to be able to share these hiking and doing personal work along the way with the therapist. Therapists hurt in just the same way that everyone else does, with depression, anxiety, insecurity, conflicts in love relationships, insecurities about how to handle this or that challenging, critical client, and it's just terrific to be able to open up with folks like that. And we've got a number of people here. John, it's great to see you. Welcome. I'm going to like you here. And on the hike today was your buddy and my buddy Stephen Fleiterer. And he said he had emailed you and hadn't yet heard back from you, so he's eager to hear back from you if you want to touch base with him. I think he's a good guy. And Lisa, I'm liking you, and we've got Nekoch Babak. It looks like a Greek name. I don't know how to pronounce it, but thank you for coming. And we've got Tim Barron. Hi, David. Hi, Tim. Elisa, Juliana, Phil McCormick, and I think I've been getting some neat, thanks Phil for your comment that you can hear me, some neat emails from Phil recently, and for many of you. We've got Rand Smith, Julianne Linden, Ron Fox, I'm going to like you. Excited to watch you. Well, I'm excited that you're on board, Ron. Mary Hosbrough. So I just selected a few questions as usual to get us started, but this is a Q&A for everyone, and I'll take questions from patients, from therapists, from the general public, any mental health related theme. There's no such thing as a silly or stupid question, so if I might not know the answer to your question, but I'm always happy to share my point of view. Oh, one exciting thing that's coming up is that my dear colleague at Stanford, who I just love teaching with, Jill Levitt, she's a clinical psychologist. She started as a student in my free weekly training group at Stanford. I must have been 5, 6, 7, 8 years ago. She'd moved from the East Coast and showed a tremendous aptitude for team therapy, did personal work on a number of occasions, and then I invited her to become a small group leader, which she resisted at first, and then became a small group leader, and then eventually became a co-leader of the Tuesday group, and we teach together. And when I work with Jill, it's just magic. I would say this of the other teachers in our group, in fact, everyone in our group. But Jill and I have a special chemistry together. We approach teaching and therapy slightly differently, but with tremendous overlap. And it's kind of like 1 + 1 = 3. Well, for a long time, I've had the fantasy of starting something called the Jill and or David and Jill show, or maybe it should be Jill and David show. Probably less chauvinistic that way. At any rate, I don't know what the Jill and David show is going to be. It's just that when we work together and work with people, treat people, answer questions, it's just a fabulous thing. Magic emerges. And so Jill's going to join us as an experiment on one of these Sunday afternoon Facebook broadcasts. Now, it'll be a few weeks down the line because she's tied up for a few Sundays, but that will be coming up soon, and it's something I think to look forward to. We don't know the format, but we'll probably have a presentation for you at first, maybe for 10 or 15 or 20 minutes, some theme that everyone can relate to in terms of depression or anxiety or addictions or relationship conflicts, and then we'll open it to Q&A and see if we can connect with you folks too. But we'll be able to role play and demonstrate things, so it'll be quite more dynamic than when I'm just talking to you like this. But here, Rand Smith already asked a cool question, as did Ron Fox, as did Klaus Strom. Well, this is my cup runneth over. Before I go to my canned prepared questions from people, I'll address yours here. Rand Smith, about your Team CBT workshops, there have been people, have there been people with closed minds who take your course who do not believe what can be achieved with Team and then change their mind like you did when you met Aaron Beck? Yes, there have been a lot of them like that. At my summer, and I've mentioned this before, but I do a live demonstration at most of my workshops. I ask for a volunteer to come up, generally the evening between day 1 and day 2, and then I do a live demonstration. This summer at the San Francisco one in Burlingame, Jill Levitt was actually my co-therapist, and a young woman came up who had really had, I think, a pretty tough time of it, and I think probably chronic, very significant depression, probably since she was a child. And but she was a therapist. She herself worked with teenagers, but had never really overcome her own struggles and self-doubts. And she was a lovely young woman, and it was just one of the most phenomenal experiences I've ever had doing therapy or live demonstrations. But it only took about an hour and 10 minutes. And not only did she improve her depression and anxiety, went absolutely to zero and beyond. I would say she was euphoric at the end. Jubilant would be the word. And it was so fast and so fantastic that quite a few of the people who attended on the evaluation form, they were quite angry and skeptical. Not everybody, but maybe 5 or 10% of the people, they did not believe what had happened, and they thought that I was a con artist and that she was an actress that I had hired, and it was kind of painful for me to see that. But I understand it in a way, because the idea that someone could completely recover, an hour and 15 minutes or an hour and a half, who's had a lifetime of refractory depression, is hard to believe, but it did happen. And then as the workshop evolved and people began to warm up, it was a 4-day workshop, people began to open up and to do their own personal work and to see what things were possible. And then at the last part of the workshop, I did relapse prevention training, and had her volunteer and to come up and show how she would talk back to her negative thoughts and crush them when they reemerged. And at that point, people saw she really was changed. She really had turned into a powerhouse. And then they gave a standing ovation in that workshop. But you're right. It's hard for people to believe it. And then to help people more, Lisa kindly, Kelly, who's with us and who's been helping with these broadcasts and helping to get some marketing for Team CBT and for my efforts, went to her home and interviewed her on camera about 3 weeks later, and she was still beaming and joyous. She's a beautiful, charming, really vivacious person. When she let her personality out, it was just like popping, Jack in the Box is popping out of the box. And she kindly let us post that on my website. And so I don't know if Lisa would have time to try to track that down. We could put the link, but you can find that. It's one of my blogs. I probably posted it as a Feeling Good blog, and it would have been posted around, probably the fall of last year, Lisa, like whenever you were interviewing her, and then we posted it a couple of weeks after that. But yes, and I get into a lot of trouble, and I don't know how to explain it to people that I have developed, with the help of colleagues at Stanford, what feels to me like an amazing breakthrough in psychotherapy. Some of it might be because I'm well known now. Maybe I have a bit of a charisma or something, but I see it on hikes every Sunday. I see it when we do live work in the Tuesday group. I see it when I do live work in workshops, people recovering with just amazing speed. And a lot of people, they just don't believe it. They think I'm a fraud or something like that. And it's painful in part because it's based on actual developments. The team CBT is based on research on how psychotherapy really works, and we've taken the effective ingredients and put them together in this super package, you might say. And the methods, for most people, not for everybody, but for 90% of people, are incredibly effective, especially for depression and all of the anxiety disorders. And so, yeah. Oh, and here John says Jill will be great in this format. Thank you for that, John. Yes, and once you've seen Jill, you know what a brilliant person she is, but also a very gracious and humble and compassionate person. So anyway, thank you for your question, Ran. Klaus says, any thoughts on crying during therapy sessions? I had a psychiatric resident named Paul at Stanford who was coming to my weekly training group a number of years back. He was an older guy who had another career, and then he decided to, I guess, go to medical school and do a psychiatric residency, but he was a really warm fellow. And he said that he wanted to do some personal work and get some help on the Tuesday group. He said he'd been working with a man who had terminal cancer. Although he's a psychiatric resident, psychiatric residents still make the rounds with medical patients in the Stanford hospital if there's some psychiatric issue, and I guess there was. So he'd been working with this fellow, but he said on the last day of his rotation, because the residents, they go from rotation to rotation, and so they leave their patients from one rotation, go on to the next OBGYN or some other rotation in the hospital, and he said the last day when he was saying goodbye to this patient, he'd grown very fond of this patient, and he said when it came time to say goodbye, he became very tearful, and so he held back his tears because he didn't want the patient to see him crying, and he knew that the patient was going to die within maybe a week or two or something like that. And he said, okay, well, yeah, I'll catch you later type of thing, and left. And then he went down to the residence room where the residents do their notes and stuff, and began sobbing. And then he said, did I do the right thing? Is a psychiatrist or psychologist allowed to show your emotions and cry during therapy sessions? And to my way of thinking, the answer is absolutely. You can do that, and it's a gift if you can do that. Now, there's a difference between enlightened crying out of a sense of love and compassion and the crying of a depressed person who's saying, I'm a hopeless, worthless human being. But if you're crying out of compassion for the person who's suffering, I would say those tears, that's like manna from heaven. And And I think the difference between a technician and a healer is a healer is one who's done his or her own personal work and has emotion and can share that with people. In my book, Feeling Good, I wrote a chapter on sadness is not depression. And I talked there about how I had this dilemma myself when I was a medical student. And, I was a terrible medical student. I cut classes. I shouldn't have gone to medical school. I wasn't a pre-medical student in college, and it was just, I had some bad advice to go to medical school, and so I did. But I was very inept, and rebellious. I had a bad attitude. But this one night, I was supposed to be following around residents on the inpatient unit, the medical unit, or might have been the surgical unit, I don't know. But we had this man who, he was an older man, a really nice guy, and he had kidney cancer. And so we did surgery and we removed his kidney, and I thought the prognosis was great. And then, so he was recovering there. And one night, the resident, so you've got interns who are above medical students, and then residents who are above interns, and then senior residents who are above them, and attendings who are above them. So the residents said to me, do you mind hanging around the unit tonight? And I didn't know why he said that. And because I didn't have anything to offer. And so I said, oh, okay, yeah, I'll hang around the unit tonight. And then the nurses said, oh, the family needs to see you there in room such and such. And it was the man that we'd operated on. And what had happened is he suddenly developed a metastasis to his liver. And at least at that time in history, this was terminal. There wasn't anything you could do about a liver metastasis of a cancer. And he was slipping quickly. And so his wife came and sat next to him night and day. And they just let her stay there all night. And she would just slump her head, when she got to sleep, and just sleepy, and just flop her head on his pillow or on the bed. And then she'd wake up, and when you'd go in, she would be stroking his head, and she was saying, he's my man, and, I still love him. And I felt so sad because he reminded me a little bit of my own grandfather who I loved. I had a little bit of a hard time as a kid, I would say. But the one person who really showed me love and affection was my grandfather, who lived in our basement in Denver, in our house. And so I was sad. And so I went down to the room, and here all the family was there, his children and grandchildren. There were about 8 or 10 or 12 people huddled around his bed. And I realized that he was slipping into a coma. And apparently he was put on the urgent list or something, so that's why they called the family in. And so I asked if I could help, and they said, well, the catheter in his penis is uncomfortable for him, and does he still need that? And I knew what they were asking. So I said, well, let me check with the nurses station. And I said, the family wants to know if he still needs that catheter, if it would be okay to remove the catheter from his penis. They said it would be okay to, the catheter from his bladder, it's going up his urethra, going up into his penis, into his bladder. And they said, yeah, it's okay to remove it. And I said, well, does that mean he's going to die tonight? And they said, yes, that's what it means. And I said, well, I don't know how to remove a catheter. How do you do that? Because I didn't know anything. I was such a lousy medical student. And they said, oh, well, there's just a little clamp with a little balloon thing, and just take the clamp off, so that'll let the air out of it. Then you just slip it out. That's all you have to do. So I said, okay, I think I could do that. So I went back in. I said to the family, yeah, it's okay. It's okay to remove the catheter. So I'll pull the curtains around it and around him, and I'll just remove it. And so I did that. It took about 30 seconds, and then I opened the catheter up, and I looked at them, and they were all like real tearful. And they said, "Well, what does this mean? Does that mean he's going to die tonight?" And then I got real tearful. Tears started forming in my eyes. I got choked up, and I said, "Well, yes, that's what it means. But he can still hear you. He's slipping into a coma, so you can stroke his head and talk to him and say goodbye and tell him how much you love him." And then I said, "What am I going to do? Am I going to show my tears, or am I going to kind of fake it?" And then I just started crying, and they could see the tears going down my cheeks. And I said, I loved him too. He reminded me of my grandfather. And then they all came up and started huddling around him, and I went down to the residence room and started sobbing. And I didn't know if I'd done the right thing, but a couple days later, I was walking down the hall of the Stanford Hospital, and the chairman of the Department of Urology, that's the kidney surgical specialists, the ones who had, removed the kidney, he said, "David, could I talk to you for a moment?" And I thought, oh no, I'm going to get slammed for inappropriate behavior. And I said, "Oh yeah, that's fine." And he took me down to his office, and he showed me a painting, and it was of a horse. And he said that elderly gentleman gave this to me as a gift, and I loved him too. And the family wanted me to tell you how much what you did, how much it meant to them. And then there were tears going down his cheeks as well. And I've always felt, and this is hard for some people to understand, but that tears, sadness without cognitive distortions, is not a form of suffering, but a form of celebration. It's a joyous thing to love and to feel love and loss. When we lose people we care about, and I've always believed that a therapist who can have emotion and share that emotion, be real with patients while maintaining professionalism and having wonderful technology of tools to bring about healing and recovery, that person is a healer as opposed to just being an outstanding technician. So that's my idea about that. And Yehuda from Mexico City says hello. Well, hello to you. Good to talk to you today and to see you. And then hello from Central Illinois. It's my first time tuning in. Mary Hosbro. Well, thank you and welcome. And I'm trying to like everyone. I can't figure out who I've liked and not liked, or I like everyone I can when I see a like button. Luz Buena says, "Hi, Dr. Burns. I continue to listen to your podcast and read your books and find them very helpful. How long a time, based on your experience, do you estimate an experienced mental therapist needs to treat using Team CBT tools sufficiently?" Well, let me tell you here, I can tell you what my experience is like. I don't know what practitioners in the field, what experience they're having. My colleagues say that the Team CBT techniques are dramatically speeding up their treatment for depression and anxiety disorders. Most of the time when I work with people, and again, my experience may not be typical, but if I'm seeing someone for the first time who's struggling with depression or anxiety, and that doesn't mean an addiction or a relationship problem, because they typically take longer. But if it's depression or any of the anxiety disorders or a combination of depression and anxiety, I would say 80 to 90% of the time, I see a complete elimination of symptoms in a single therapy session of 2 hours approximately. I like to complete treatment in in one sitting, in one session. And then after that, you can do relapse prevention training. You can do tune-ups. If the person needs tune-ups, that's perfectly okay. They may want to work on other issues. But I like to see the main issue that the patient is struggling with resolved, very, very quickly. When I began doing workshops and treating people in workshops, I used to see this maybe 40% of the time years ago, and then 60% of the time the live demonstration wouldn't go so well, or the person would be resistant or whatever. But now that we have the resistance busting techniques or resistance melting techniques, I'm saying that at least twice as often. I have a colleague from Hong Kong who has learned the Team CBT model, who works with immigrants primarily, many people who English is not their first language. He treats some of them in Chinese. Sometimes he has to have an interpreter in the room if they're Spanish speaking. And he only gets about 35 minutes a session with his patients. And Sunny Choi is his name. He works at a mental health facility and gets referrals from physicians of patients with pretty severe depression and anxiety. He says that his average treatment is like 3, 4, 5 sessions, and then he's kind of completed the therapy. And he says his patients don't find that strange, because most of them aren't American, so they don't have this concept of long-term psychotherapy. They think you go to the doctor and you get, cured pretty quickly, although that word cured, mental health professionals hate it, and I've been criticized for using it and probably shouldn't use it. But Matt May is a colleague of mine who is in private practice. He's an outstanding therapist. And he says, too, that most of his patients, he's seen an elimination of symptoms in 4 or 5, 6 sessions in that range. But there will be many people who will be tougher to treat for a variety of reasons, and that's okay. It doesn't mean there's anything wrong with you if it takes longer to get the job done. But to me, it's exciting that what appears to me to be a genuine breakthrough in treatment, new techniques that hold the promise of more rapid recovery. So that's my best answer, Luz. Let's see. Tim Barron asks, what if a client needs time to be ready for the high-speed change of team therapy? You spend time with the client to develop a greater sense of trust, more than one session or two. It has been my experience that it often takes time for the therapeutic relationship to develop. Well, that's a really cool question there, Tim. I'm going to click your like button, and Phil, I'm clicking yours too. Or let's see if the like button there, I think it worked. Part of the team model, it's testing, empathy, agenda setting methods, and that's the linear sequence of what happens in a therapy session. And we do pretty rigorous empathy training with clients or patients, whatever word you want to use. And in the training groups, we put the therapist through very severe, very intimidating exercises to learn to develop world-class empathy skills. And I've tried to do that for myself too, because I started out with pretty poor empathy skills. And I think we can ask Jill again when she joins us, because she's out in the field doing real therapy at the Feeling Good Institute. But she and I both agree that you can develop an A+ empathy, like the best trust humanly possible with another human being, in most cases within 20 minutes of meeting them for the first time, if you use what we call the 5 secrets of effective communication. You're absolutely right. It does take time for trust to develop, but it can be developed much more rapidly than most people in the general public understand is possible, and what most therapists understand is possible as well. Also, we have the patients rate us at the end of every session with an exceptionally sensitive scale, empathy scale, that measures trust, warmth, understanding. We also have a scale that measures how helpful was the session. And these scales are extremely sensitive to the smallest therapeutic failures. And we require people in our training to have every patient fill this out in the waiting room after every single session, as well as other scales that rate changes in symptoms like depression or anxiety. And most therapists initially discover, even with patients that they thought they had good trust with, who they've been working with for months or years, they'll typically get failing grades on the empathy scale and the helpfulness scale from every patient at every session, and it's shocking to them. And then they learn that their empathy skills are really not very good. On the other hand, once they go through the empathy training program, most of my students and colleagues report that within 3-4 weeks of using the empathy scale at every session and practicing with the 5 secrets of effective communication, they can get perfect empathy scores and perfect helpfulness scores from 80% of their patients. And so it is possible to make a dramatic improvement in your interpersonal skills if you're a therapist. Now, also, my Feeling Good podcast with my host Fabrice and I come out every Monday. And we've just completed a series on the 5 secrets of effective communication with exercises that you can practice those as well with loved ones and colleagues. But the time, in my experience, for what it's worth, is not important in empathy. It's the manner that you relate to the other person. And if your empathy skills aren't good, you've got to hang out with someone for years and never develop the trust. And if you've got tremendous empathy skills, you can transform therapeutic failure into success with most patients in a matter of minutes. And that's, again, a lot what we're practicing on today's hike. One of the therapists is a very gifted psychiatrist, and she's been working with a woman who's very angry and kind of withdrawn and won't open up or be vulnerable, and was kind of lashing out at the therapist and saying, I don't want to talk about our relationship, and other criticisms. And how can she respond to this woman more skillful in a way as to open up the relationship and develop the possibility of trust? Nicoch Babach, again, I wish I could pronounce your name better, but without audio feedback, I don't know how it's pronounced. But hello, David, I am vegan for ethical reasons, and I'm thinking about eating meat again for social reasons and convenience. The problem is I'm very guilty and anxious about betraying my morality. Any advice on this? Well, I don't actually believe that therapists, for the most part, there's exceptions, but for the most part, should be giving moral advice or telling people what values that you should have. Let me say personally, I do eat meat. However, I have tremendous admiration and respect for people who are vegetarian, or, to take the next step, vegan, which I think shows a profound respect for the earth and for the animals that populate the earth. And since I was raised as a meat eater and still am, you probably think I'm a big phony, and I probably am, but that's how I feel. So my hat's off to you, absolutely. Now, when a person is uncertain about things, I see my goal as a therapist to help you sort out your options and come to your own conclusion. I have developed a pretty sophisticated tool called the decision-making tool, where you would list a series of options when you're indecisive, like 3 or 4 options, and then select your top 2. And it's a 4-compartment analysis. What are the advantages and disadvantages of, say, remaining a vegan? And then what are the advantages and disadvantages of eating meat, changing your diet? And there's kind of a complex rating system. I don't have the time or capacity to show you how it works in this format, but it helps you sort out your options and see why you're indecisive, and helps guide people to a decision. And on today's hike, one of the hikers said, should I break up with my boyfriend, or should I try to deepen the intimacy and trust and warmth and vulnerability and connection between the two of us? And again, that's another good thing for a decision-making forum. She was saying she has another therapist who seems to be telling her you should break up with this boyfriend. And I don't know why the therapist would be saying that, but my own role as a therapist, I don't feel like I'm a guru who knows what people should or shouldn't be doing. Part of my growth and freedom as a therapist was to develop greater humility and to see myself as the patient's helper, not as an expert in what people should or shouldn't do. I see my role as a therapist kind of like a plumber. If you've got a broken toilet, call me, I'll drop by your house and fix it. And then we're done. But I don't see myself as an evangelist who goes from house to house selling people on buying copper pipes or something like that. It's a different model of therapy. Let's see. Let's see. Lisa, yes, says the video that I referred to earlier in today's podcast was posted on David's website, feelinggood.com, www.feelinggood.com, and feeling good is one word with two G's in the middle. And if you go there, there's a widget in the upper right-hand column of every page where you can sign up there, put your email address, and then you'll get all my podcasts and notifications when there's new Feeling Good podcasts and all kinds of cool things like that. It was posted in September of 2017. I think it is also on the Feeling Good Institute Facebook page in the video section. And Lisa was saying she was in a certain city, which I won't say where it was, when she met up with the patient. And the video, it says see more. Let's see. Anyway, she said that was her first Facebook Live video. I didn't know it was a Facebook video, but that's fine. And then leading us later that fall to create David's Facebook Live broadcast, as you were saying now. David had no idea I was doing the broadcast, or I guess the follow-up video, but I was thrilled to see it. It was a great video, and you can find it there on my website if you find the tab for blogs, and then I do 5 blogs, and I'm pretty sure it's a Feeling Good blog, and then you just scroll down backwards to September of 2017. I think you can find this lovely and really charming and inspiring video. It's short, but it's really cool. Here, Rand Smith says, thank you for sharing that experience with us. My other question is, have you published your research on how it has been received by the community and other researchers? Have you published? The research that I have published has been what's called process research rather than outcome research. I've been a private practitioner rather than a full-time academic with grants. And so I can't take patients who come to me and do random assignment to therapy versus placebo or whatever. I have to give the best of what I have to everyone, but I've collected data always in my practice, that leading up to the super sophisticated method that we have now for collecting data at the start and end of every session. But I put the data into computers and, with patients' permission, then done statistical analyses looking at patient data over time to say, how does therapy work? What are the things that cause therapy to succeed? What are the things that cause therapy to fail? And it's from the discoveries from that kind of research that I've published primarily in top psychology research journals that's led to the development of Team CBT. it's my understanding that Moore Katz, MD, a former student who's the head of the Feeling Good Institute, is working with Dr. Kim Bullock at Stanford and Dr. Mickey Trockel at Stanford to do an outcome study at the Feeling Good Institute, a longitudinal study of the effectiveness of Team CBT. I'm not involved in that except to give them some suggestions, because I think people who create a form of therapy should never be allowed to test it, because that's a conflict of interest and people get very political and cagey about their data. But I'm hoping that that study will get started, or perhaps it's started already, and will give us some important data, because there's really two crucial questions. First of all, how effective is Team CBT as a therapy? And then how effective are individuals as therapists? Because you could have an individual who's not a very good therapist learn a new form of psychotherapy and get crappy results. And you could have a therapist who has wonderful interpersonal skills and charismatic and warm and inspiring and gets patients fired up and excited, and they could probably use any old form of therapy and get superior results. So it's kind of tricky, but you're absolutely 200% right. We need to get it's time for outcome studies to see, is CBT actually more effective than conventional CBT or antidepressant drugs or psychodynamic therapy or DBT or REBT or EMDR or ACT or etc. What is your opinion about EMDR? Are there tools in the school of EMDR find useful or powerful? Well, EMDR, I mean, I'm a bit of a cynic, I suppose, and EMDR has tons of advocates, so how can you argue with that? But and my thinking will be skeptical, simplistic, and if anyone wants to attack me, it's totally okay. I'm often wrong. I get strong opinions and I'm often wrong. But I see EMDR as kind of cognitive therapy with exposure, like you've had a traumatic event, you think about it. But during the exposure, they do eye jiggling like this. They say, move your eyes back and forth while you're thinking about some traumatic event that freaks you out, or while say you have the fear of heights, you get up on a ladder and you jiggle your eyes, I guess. And the idea is that this jiggling the eyes back and forth causes more rapid recovery than the whole EMDR package would be without the eye jiggling, or sometimes they do rhythmic knee tapping or whatever. Personally, I don't believe that this rhythmic eye movement thing contributes to the package. I believe, for example, you could do a study with pseudo EMDR. Like both packages would be the same. You do all the cognitive stuff and the exposure stuff, but you would have one group, jiggle the eyes, and the other, you could say, tugging on the ears non-rhythmically during the exposure. And I feel confident there would be absolutely no difference in outcome, or in a third group that would just do the whole package with typical exposure. But people don't like to hear that, particularly if, hi, Phil Dudar, one of my buddies. It gives me joy to see you here today. But people, they get kind of almost religiously focused on the thing they believe in, and they get angry at people who raise questions about it, and that's why I feel that we need to move away from the schools of therapy and move more into a science, a data-based science of psychotherapy. Victoria Niederhofer. Dr. Burns, what do you recommend for social anxiety? I've done a ton of shame-attacking exercises, which help me so much. But I still have a fear of specifically getting close to female friends. A typical thought I have is, I will have nothing to talk about. I've tried the David Letterman technique, but I feel like it almost creates an awkward imbalance. Yes, I see what you mean, right? in that I'm still panicking inside and avoiding calmly connecting by always asking them a question. My social anxiety has improved, but I still have a little left. Well, I cannot treat anyone ethically or safely, through this public forum, but I can give you some general teaching. And see, part of the problem as I see it is you're thinking that your social anxiety is a bad thing, so you're trying to control it or eliminate it or reduce it or hide it through the David Letterman technique. And by the way, for those of you who don't know, the David Letterman technique is one of about 15 techniques I've created to help people with social anxiety. My favorite problem, by the way, in the whole world, because I've had crushingly severe social anxiety myself. I've had 5 different kinds of social anxiety, including intense fear of cameras. I just got over that within the past year. I've had it since childhood, and I've had, shyness and horrific public speaking anxiety and on and on. And so I love treating shy people because I can say, man, I've been there myself, and I know how awful it is, and I can show you the way out of the woods. But one of the things that you're doing, which to me is a mistake, is you're hiding your anxiety, thinking that it's abnormal or there's something wrong with you. And you might want to try the technique called self-disclosure, and you can try it both with your female friends and also with strangers, if you like. We do it all the time on hikes. We do it almost every Sunday. I've shy people on hikes, therapists typically, walk up to strangers and say, could I talk to you for a minute? I just want you to know I've had crippling social anxiety ever since I've been a little girl or a little boy, and I've been hiding it from people for decades, and I've been ashamed of it. And today I decided to stop hiding it and to start telling people, and that's why I'm telling you. And it's such an effective thing, and you could do this, with your friends, and you just say, I tell myself, I probably won't have anything to talk about, and maybe you'll find me a boring, uninteresting person, and I'm so ashamed and so anxious, and so I've just decided to stop hiding these feelings and sharing them, and that's why I told you just now. That's called self-disclosure. I had a patient who came to me once from New York City for treatment, and he flew down in his private plane, and then he was met at the airport by a chauffeur-driven limousine, and he was driven to our hospital in Philadelphia, which is an inner city hospital, Presbyterian Medical Center. It's in a kind of a gang warfare area, and we work typically with a pretty down-to-earth group of people. We didn't have any fancy, wealthy people, and the limousine would park in front of the hospital, and then he would have the chauffeur stand at attention and wait for him while he came up to the treatment, to my clinic up on the 3rd floor or 5th floor, wherever we were for his therapy. And he said that he owned one of the companies on the New York Stock Exchange, so he was incredibly wealthy. And he said that whenever he's in control, he feels just fine. He can run meetings, boss people around, this type of thing. But he said when he's in an unstructured situation, he's incredibly shy and anxious and insecure. He says he's even insecure around his wife and children and has never admitted this to them. And he's constantly feels uneasy. He's constantly trying to control his feelings. And so I told him, I want to give you an assignment. I want you to go and get on the subway. And, there's a station, just a block or so from the hospital. And I want you to ride on it for 3 hours. And I want you to just move around and sit down and next to strangers. And that I want you to tell them that you're an incredibly successful businessman from New York, but that you've always had crippling social anxiety, and that you're scared of people, and that you've been hiding your feelings, and that you've decided to start telling people today. Now, do you think he wanted to do that? Absolutely. He fought tooth and nail. I can't do that. Oh, that would be terrible. People think I'm a fool. They think I'm crazy. And I said, if you want me to treat you, that's what you're going to have to do. And it's not a negotiation. It's a gentle ultimatum. And if you don't want to do that, I say, God bless you. I wish you all the luck in the world, but I'm not the therapist you're looking for. This is the price of enlightenment if you want to change your life today. You must do that. So he very reluctantly agreed to it. Now, as a therapist, you have to be careful when you give these extreme assignments to know who you're dealing with and what their resources are. And for some clients or patients, this might not be an appropriate assignment. But he did it, and he came back 3 hours later, and he was just in a state of euphoria, and he was stunned. Now, of course, the people who ride the subway are your ordinary working class folks. They're and sometimes there's like streetcars. They come up above and they're going on the street, and then they go underground again. And they're not fancy people. They're all races and ethnicities. And he said he couldn't believe how warm and loving people were when he told them that. And they all said, oh, I have a son who's very shy, and I'm so proud of you for saying this, and I feel so close to you. And then they would start to open up and talk about their lives. And he said he connected with people for the first time in his life. And part of the issue here is you see, you're thinking that your shyness, your anxiety is shameful and bad. At least most shy people feel that way. I know I felt that way. I thought there was something wrong with me. And what we're doing here is we're turning your mud into gold. The problem isn't the shyness, but the shame. And this is called a shame attacking exercise, but self-disclosure is more of a gentle kind of, rather than a silly, outrageous, doing something outrageous in public, ridiculous. That's a great technique as well, but this is a little gentler thing. And if you try that with your friends, Victoria, and I wish I could talk to you right now and say, does this sound easy or difficult? Is it scary? What do you think? But if you get a chance to try it, maybe at the next broadcast, you could tell us, how that worked out. Oh, by the way, Lisa Kelly is saying the blog that I referred to is October 17th, 2017. That's where you can find it quickly on the Feeling Good blogs. And it's entitled, Was It Real or a Hoax? That's the title of it. And the video is embedded in the article he wrote. I don't know what article you're referring to, but I have show notes. I had wrote information with that video that I posted. Lisa says it's not opening on her cell phone. Maybe you'll have better luck. Well, it should be able to open on your computer. And Lisa's saying, well, I'll make sure we check that tomorrow with our technician. Please let me know if the video opens up for you. Yes. But yes, was it real or was it a hoax? You can see this young woman who had this miraculous transformation at her summer intensive in Burlingame, and she's so neat. You'll just love. It's about probably a 15-minute video or something like that, but it is so cute, and she is just so delightful. Ron Smith says, Lisa Kelly, I'm on a PC and it works here, and it is the link, and then he's putting the link, and I presume other people can see this, so just look at Rand Smith's link there if you want to click to that. And Rob D. Gregorio says, so profound. Rob, I love you. I'm not trying to be inappropriate. Rob is my two biggest, best fans in the world are Rob D. Gregorio from Boston. There's a really smart and really nice guy, and we email a lot after the Feeling Good podcast every Monday. Rob has been to a lot of my workshops, just a fabulous person. And my other biggest fan was my cat, Obi, who died, disappeared about a year ago. And when I get ready to publish my book, Feeling Great, the sequel to Feeling Good, it's going to be dedicated to Rob and to my cat, Obi, as weird as that might sound, assuming that's okay with you, Rob. And Elise, hi, David. Let's see how we're doing on time. Yeah, we just have a couple minutes left. Thank you so much for all of your groundbreaking work. I can attest that TEAM really has dramatic therapeutic effects. Oh, thanks for sharing that. That's important. Elise has a Feeling Good Center in New York City, one of our 2 Feeling Good centers there. So if you're in New York, you go to my website, feelinggood.com, to the referrals, and there's a write-up about your center, Elise, as well as Taylor's, the other Feeling Good Institute and center there in New York City. But you have one of the 2 and some wonderful colleagues. And you say our clients and staff also really appreciate the podcasts and are learning from them. You have touched so many lives, and thank you for that. And yeah, on all of you, you can help me and help Lisa Kelly and others by, if you like these broadcasts or my Feeling Good podcasts or my website, is to spread the word, because I don't have any advertising or anything, and so I rely on your word of mouth, and so if you can get other people to listen, or who might have a mental health issue or a personal problem with depression, that's great. Julie Ann Lending has a really neat comment. A former client, I presume a client of yours, Julie, returned to proudly show me his 5-year AA chip. I guess that's Alcoholics Anonymous. Julie says, I cried. I will never forget him. Thank you for sharing your beautiful story. Yes, and I sometimes feel that when we cry, we're the most alive, especially if you're not distorting things. In fact, I don't know if I remember this last week, but last week on the hike, one of the people I worked with said she was very upset. If I'm repeating myself, well, chalk it off to senility, and I'll make this short, but she was upset because it was exactly, the hike was a 1-year anniversary of her father's death. And she had been getting all upset and tearful and feeling an emptiness and telling herself, I'm not supposed to feel this way, and fighting against it. And the solution on the hike, which we went through systematically using team therapy, not just explaining it to her, but leading her to this, was that her tears were a beautiful thing. It showed her love for her father. And you know, if you didn't have those tears, there would be some coldness there. And that she can be proud of her tears, proud of her grief, proud of her father, who she loved profoundly. And then I just gave her the assignment to, cry as much as she could in the week. And then she came to today's hike, and she said she felt light, and she'd had many good cries and felt much better after them. Yeah, tears can be a beautiful thing. Lisa says, on December 26, 2016, David Fabris and I have produced a Feeling Good podcast and interview discussing the question, can depression really be treated in 2 hours? David and I wrote a long 20-plus page Q&A article about it prior to the podcast. And then we spent months writing it. So Lisa, a former reporter and seasoned therapist, could challenge his claims that a complete elimination of symptoms of depression in 80 to 90% of cases. I needed to be convinced. The article was based on the question I posed to him in a Denver workshop in 2015. It's on David's website, feelinggood.com. That's a good point, Lisa, because we've really addressed it. And then correction, that's a 20-plus page interview, hard to type on this computer. Yeah, but yes, there's a lot about that. And, you know, on feelinggood.com, there's just tremendous resources for therapists and for patients. And then Ron says, here's the article by Lisa, and then here's a link to it. HTTPS, you know, feelinggood.com/Lisa interview part 1, you know, version 19 PDF. So there's a link, then you can find that if you'd like to learn more about that topic. It's 4:01, so we'll have to stop. I'll just read a few of the questions out loud that we can address in the future. What do you suggest for relating to people who are truly narcissistic? Well, I love treating people who are narcissistic because I am narcissistic myself. And so I'm pretty tolerant of them. And but the question with anybody, you don't treat narcissism. You treat what does the person need help with. I've treated a lot of people with intense narcissism, but I'm not trying to cure them of narcissism, which might be my agenda. I'm trying to help them with what they want help with, and that's one of the important keys to Team CBT. And then Lisa Kelly says, for social anxiety, David says, don't try to hide it because you're ashamed of it. You can use self-disclosure with people up front. Be vulnerable and start to something kind of tapered off there. But yes, that's it. And yeah, Josh Kaskin, I've got to tell you something funny. I always wondered what would happen if one had a panic attack during a job interview, just to admit it. While it may not get you the job, it may help the person who has panic attacks feel empowered. I bet the panic attack would stop cold after admitting to it. Oh, absolutely. And there's this TV program called Impractical Jokers. Probably a few of you have seen it, but these guys do bizarre things in public, make fools of themselves on purpose, and they give each other assignments, and it's entertaining. But I remember one of them, this fellow, his assignment, he had to go in for a job interview, pretend he was some high-tech thing or to be a receptionist at a high-tech firm, and the serious fellow was interviewing, but he had to wear just a T-shirt with the nipples cut out. It was just a total absurdity. So if you're afraid of having a panic attack on a job interview, maybe you should just get some job interview with something you don't want and then just go and freak out and have a panic attack and get it out of your system. And as you say, once you welcome it and aren't fighting it, it'll probably stop it cold. And Rob says, mud into gold. Wow, yes, and that's kind of yeah, exactly. And then Tim Barron says, what about Zoom instead of Facebook so you can interact with others? That's exactly what I'm thinking, Tim. I don't know what it costs on Zoom, depending on the size of your audience, but I think that's the direction I need to go, you know, especially like with Jill, the David and Jill show, so we can get some two-way interacting. That would be mind-blowing. Well, we're over time. I'm not going to keep you over. Rob says I'd be honored to be mentioned with Obi, and Rob, I'm just honored to have had the chance to know you. I just think you're awesome, and I think all of you are awesome. And with that, I thank you all for this great hour we've shared, and have a wonderful time. Oh, by the way, I think Lisa said, because next Sunday is Super Bowl, I think we're going to skip next Sunday, so I'll be seeing you 2 weeks from today, and have a wonderful 2 weeks. Bye-bye.